Here is the new notebook, which contains the most basic and necessary information in ICU. On the first page is an organized and comprehensive calculation process for the ideal body weight for males and females in centimeters and inches, along with the tidal volume, if multiplied by 6 or multiplied by 8, in addition to 2 equations to calculate the ideal body weight. On the first and second pages is the most important information related to the high and low oxygen therapy system, the method of calculating the oxygen consumption in the cylinder, and the most appropriate time for use. On the third page, the oxygen dissociation curve, incentive spirometry, and indications and contraindications. On the third page is the oxygen dissociation curve. On the fourth page, the guideline and method for choosing an endotracheal tube, the required tools, indications, and contraindications. On page 5, a guideline for choosing the appropriate endotracheal tube and size for pediatrics and appropriate size for tracheostomy tube. On page 6, appropriate endotracheal tube size for adult male and female, and how to calculate the size. On page 7, basic information about the ventilator and normal rates, and guidance for choosing an endotracheal tube and suction device for newborns. On page 8, successful intubation, indication of tracheostomy, how to choose the size for the suction catheter, and appropriate suction pressure for adult, pediatrics, and neonatal. On page 9, normal range for elderly adult, pediatric, and neonatal, temperature, heart rate, respiratory rate, blood pressure, and SpO2 and disease state summary. On page 10, hyperinflation therapy and the equipment need for suctioning. On page 11, clinical signs and symptoms of inadequate airway humidification, types of HME, and the normal ABG range, arterial and venous for adult and neonate. On page 12, respiratory failure, type 1 and type 2, and the causes for each of them, and the normal electrolytes. On page 13 to page 16, there is information about PFT and ventilatory assessment. On page 17, vital signs and medications. On pages 18 to 19, medications. On page 20, Glasgow Coma Scale, GCS page, 21 indications for using closed suctioning. Page 22, TBI protocol. Page 23, weaning criteria. Pages 24 to 28, comprehensive normal range.